A lot of parents are worried about autism. Autism has risen dramatically in the last 20 years, and now it very tragically affects about 1 in every 150 children. And some parents are concerned that there could be a link between vaccines and autism. Now, of course, many medical researchers have been looking at this issue for the last 10 to 15 years to try to see if there's a possible link between vaccines and autism. And if you look at all the research together, right now the majority of research shows there is no link. There are a few studies that call that into question and show that there might be some association between vaccines and autism, but that research is really in the minority. The vast majority of research is showing that there is no link. Now, one of the vaccines that is probably the most controversial vaccine when it comes to autism is the MMR vaccine. And a lot of parents are very worried about MMR, and a lot of families who have a child with autism feel that the autism began shortly after the 1-year MMR vaccine was given. Now, research has not been able to demonstrate that there is any definite link there, but again, some parents are worried anyway. So if a parent is really concerned about vaccines and autism, or the MMR vaccine in particular, then what you can do is you can delay the MMR vaccine. Wait until your child is 3 or 4 years old and beyond the age where autism could develop, and then give the MMR vaccine. At that point, the child's neurologic system is fully developed, the child's healthy, and there's really no way anything like a vaccine could trigger a child to regress into autism at that later age. Another link with vaccines and autism that parents are worried about is mercury. Now, there used to be a lot of mercury in vaccines. Well, now they've actually taken mercury out. And the only place you'll find mercury is some of the flu shots. So as long as you know how to be careful with the flu shots, you don't have to worry about mercury being in the vaccines and possibly triggering autism. Now, where do we stand right now with research and autism and vaccines? Well, many researchers and the government, the Centers for Disease Control, are continuing to look for a possible link, or to do research to make sure there is no link between vaccines and autism. But what I think people are now looking at is there some sort of genetic risk of autism? Is there a genetic susceptibility? Is there something about a small number of children's genetics or their metabolism or their body's chemistry that perhaps makes them more susceptible to having a severe vaccine reaction? We do know very rarely that some babies can react very severely to vaccines. And we've seen babies have severe neurologic reactions. There have been a few cases of babies getting very, very ill after having a vaccine series and then quickly regressing into autism. And those children, we think, have some sort of genetic susceptibility. Something's wrong with their body's chemistry. They can't handle vaccines very well. Well, fortunately, that's a very small percentage of all the kids overall. But what the government is working on is how can we test those kids? How can we screen all babies when they're born to determine which babies have this genetic susceptibility, which babies aren't going to handle vaccines well and possibly have a severe vaccine reaction. If we can identify those babies, then we can learn how to vaccinate them differently, delay their vaccines, spread their vaccines out, perhaps not vaccinate them at all. And I think that's where the research is heading, is how to determine which babies have a risk of autism or have a risk of a severe vaccine reaction, and finding those babies at birth and then approaching their whole vaccine situation much differently than the general population. And I look forward to seeing that research as it hopefully comes to fruition over the next few years.